Happy New Year and welcome to Season 2 of Let's Cook. I'm your host, Chef Ty. On today's show, we have our special guest, Dr. Claiborne of the University of Pennsylvania. And our topic today is COVID-19. Should you or should you not get the shot? I also welcome your questions and comments, so please email me at radio@thaisoulfood.com. That's radio@tysoulfood.com. And please send me an email. Let us now tune in to our show.
B. Childs. I'm sorry. Before we get started today, how can people listen and contact you?
Hey, well, thanks for having me on. I'm Claiborne Childs. You can find me on Twitter. It's Dr. Childs MD. That's my Twitter handle. It's CHILDS MD, Dr. Childs MD.
Well, what I'm going to do is I'm going to make sure I have that information listed on my website so people can reach out to you. Before we engage in the meat of our conversation, give our listeners some of the training and experience in education and leadership.
Yeah. Again, thank you for having me on today. So I'm originally from California. I came to the East Coast for undergrad. I did my college at Yale. In between college and medical school, I was actually a high school teacher in New York.
Oh, wow.
I got a master's degree in microbiology from Long Island University in Brooklyn. Did medical school at Georgetown in Washington, D.C. Came back to New York area for residency training. Did my training at New York Presbyterian Weill Cornell Medical Center in Manhattan. I worked at Montefiore for a few years after I finished from residency. I was a primary care doctor there, and then came to Penn in 2017. So now I've been here in the Philadelphia area for the last 4 years. I'm a hospitalist. Sometimes that I have to explain to people what a hospitalist is.
Okay.
Essentially, if you're admitted to the hospital for something that is not surgical, I'm a doctor who can take care of you. So people come in for infections, for heart failure, for uncontrolled diabetes, those kinds of things that you get admitted to the hospital for. As a hospitalist, I kind of specialize in taking care of you while you're admitted and successfully get you out of the hospital and hopefully back home. So I wear a few hats at Penn.
Yeah.
I'm medical director for our hospital medicine service at Penn Presbyterian. I'm also an associate program director for diversity inclusion in our residency program, and also I do some diversity work in my division. So I'm happy to be with you today.
You've been very busy, sir.
Yes.
You wear many hats. It's out of curiosity, what grade did you teach in high school when you were teaching high school?
I taught high school, ninth grade biology, and I taught sophomore, junior chemistry. So I taught bio and chem for 4 years. Yeah.
Wow. I commend you.
No, it was a good time.
Yeah. I'm just going to ask you some basic questions for those who don't understand, what these terms mean. So the first question I have for you is, for those who that hear the word FDA, what does that mean?
So the FDA is the Food and Drug Administration. I keep wanting to put federal in there. It's a federal agency, the FDA. It's been around for over 100 years. To give you just a little bit of history and sort of some context for the FDA and sort of why it was founded. A long time ago, you could put a label on a bottle of apple juice and say that it was a remedy for the flu, right?
Right.
Things were not regulated. There's the old expression that people, someone's a snake oil salesman. So there's someone who's just out there, bottling stuff and saying it's a cure and selling it. Around the turn of the century, in the early 1900s, Congress passed the Pure Food and Drug Act, which essentially said that for companies or for pharmaceuticals or for people to sell things and label them, they have to actually work. They actually have to have some efficacy in the area or whatever it is that they're supposed to treat. So essentially, So essentially, the FDA was essentially founded at the early beginning of the FDA. It was called the Bureau of Chemistry, which then about 20 years thereafter became known as the FDA. And so their real role is to sort of be the regulatory body. So they regulate food. They make sure that food is safe, the food that we consume in grocery stores or food that you buy from a local shop or something you might buy from a farmer's market, that these things that they're maintained safely, that the milk you drink from this grocery store is pasteurized, that it's safe to drink. And then there's also the drug piece, right? So the other part of the name is the drug. administration. So it's making sure that, if Johnson and Johnson or Merck or some other company wants to put a drug on the market to treat a medical condition, that drug is safe and that drug actually works.
Okay.
And so the FDA is really there to regulate and make sure that these drugs and these, things that are out there on the market are actually working the way they should be working. And there's a process, right? So for a drug manufacturer to put a drug out there and say, we're going to use this drug to treat diabetes, for example, or treat high blood pressure, there's a process you have to go through. They have to submit data to a board who then has to review it and then sort of say, yes or no, this is safe. You can now market it as what you've said it's going to treat. This process can take up to about 10 months. So, the process normally takes almost a year or so for a drug manufacturer or a company to submit an application for this for it then to be approved. Obviously, with the COVID vaccines, this process was sped up. And so that's what we have, which is called emergency use authorization, which is the FDA sort of shortened the time from 10 months down to, a matter of weeks. Before they were able to say, because we're in the middle of a pandemic, we need to get this, vaccine out there for people to use. So the FDA is really kind of there to be the regulatory body of all the, the food that we eat and sort of the drugs that people have to take.
Well, you answered my second questions all in that one brief thing. I was going to ask you why the FDA is important, but you blitzed through all that and just explained to why this agency is so important to us. We welcome your questions and comments, so please email me at radio@thaisoulfood.com. That's radio@TYSOULFOOD.com. Dr. Childs, here's another question that I have for you. Another basic question that I think is important. What is the CDC?
So the CDC is the Center for Disease Control and Prevention. This organization is also a federal agency. It's been around for about 75 years. It's based in Atlanta. The quick historical note I'll mention about the CDC, it sort of was born out of the end of World War II. The CDC was initially an organization meant to sort of control the spread of malaria. And so we tend to think of malaria as a problem that happens in like tropical areas. Back in the 1930s and 1920s, there were outbreaks of malaria within the southeast of the United States, along sort of the Gulf states, where things are also kind of tropical, especially in the summertime. And so from that sort of, experience of them trying to sort of stamp out disease and control it, there was sort of an opportunity for that early organization to sort of continue and to sort of work along the lines of controlling, preventing disease in the population. So the CDC was basically founded kind of in that post-World War II kind of time period. And really, their job in the CDC is part research. So they do have researchers at the CDC that are researching, learning more about medical conditions, diseases, and things like that, but also the policy piece. So we talked about the FDA being the regulatory. So I tend to think of the FDA as saying this is a safe drug to use, or this is a safe treatment for something. I tend to think of the CDC as then saying, well, how are we going to implement that treatment or implement that drug? So they're sort of the then policy, right? So we have a vaccine. Who's going to get it? How are we going to distribute it? Who is highest priority for getting it? Who is lower priority for getting it? And so the CDC is really there for us as physicians to give us some guidance about how to treat, who to treat, when to treat. The CDC, for some of your listeners, if you've ever had to travel out of the United States, the CDC is also helpful if you want to know the area of the world I'm going to, what should I be on the lookout for health-wise, what vaccinations should I get, what medication should I take to make sure I don't get sick while I'm traveling. They're really there, their main role is really in the name, right? It's about, disease, controlling that, and really preventing it. So, I view the CDC as incredibly important, I think, for us as physicians to really make sure we're not sort of working here in isolation, that we actually have some guidance in terms of, how to treat our patients.
A sidebar question, like it has to do with the CDC. Who is actually on the panel that helps make these decisions?
So the CDC's, there's a chief of the CDC that is often appointed by the White House, sort of appointed by the president. And then there's sort of a panel of scientists and other people who are sort of part of the organization that are really there to kind of do the work of approving these things. So those are people that are not really political appointees. They're scientists or people who've worked in the CDC for years, who sort of work their way up the ranks and sort of then serve in that capacity as members of their board or members of different committees to sort of do the approval process.
So the scientists and doctors is on this board that make educational decisions based on science and everything.
Exactly. They're there to look at all the data and all the, all that's out there and sort of then say, this is what we recommend, for prevention and for, controlling a disease.
Good. Thank you. Thank you for that information. Here's the big kicker. What is COVID-19 and why is it making so many people sick or even dying?
Yeah. So the short answer is COVID-19 is a really dangerous, scary respiratory virus. The sciencey sort of nuancy answer, without getting too far into going back to my virology classes in medical school or undergrad. It's an RNA virus, which means it sort of falls into a group of viruses that transmit or sort of work using RNA in your cells to sort of replicate. But these viruses, essentially all viruses, sort of once, they live in a host, right? So when they spread and move to someone, the virus's job is to get into your cells, to replicate and create more of itself, and then spread and go into more cells and do the same thing. And then if it's even better, if it can then get from you into someone else, that process can sort of continue. So, COVID-19 sort of got the name. The name, if you break it apart, sort of tells you a little bit about it. The co part is coronavirus. The co and the V, the vid, is coronavirus. The D is the disease. And then 2019 was the year that it was first discovered. So I know that for a lot of us, 2020 seemed to be the year that COVID kind of, came into our, came into our world. But we have to remember that in 2019, at the end of 2019, it was already sort of spreading across mainland Asia. So the name COVID-19 sort of comes from, it's a coronavirus that causes disease. It was sort of found in 2019. Another name we use for COVID-19 is SARS-CoV-2. If you go back to the SARS outbreak in Asia, I want to say this might have been around 2010 or somewhere thereabouts. That was also sort of a similar sort of spread of a virus. It was a coronavirus at that time as well. These viruses typically have sort of an animal, start in animals and sort of spread to humans. And so that's what sort of makes what we believe this version of COVID sort of similar to the one in the past. It's sort of where it started and kind of where it kind of went. But, these viruses are really dangerous. They're people I know initially wanted to sort of compare this to the flu. I've been a doctor now for about 10 years. This is not just a flu. I've not lost as many patients in the past year to any year that I've ever been in practice to a flu as I've lost to COVID, right? So this is a much more dangerous virus. We know that there are people that are much higher susceptibility for bad outcomes. It is spreading like wildfire. I know we might talk a little bit later about some of the different strains of it. But it's not just sort of your everyday regular sort of respiratory virus. This is one that has spread much more quickly, has proven itself much more deadly.
So this is not the flu. It's not the common
flu.
So, and you said it attacks the respiratory system.
Right. So, absolutely. So primarily it lives in your respiratory system. It gets into, in through your nose, your mouth, your eyes. It sort of, lives in your respiratory system. It can, be really damaging to your lungs. It sort of then spreads through respiratory droplets from person to person. So coughing, sneezing, breathing in close contact with people sort of sends those little viral particles into the person next to you. And so that's essentially how it spreads. A lot of the same way that colds spread, right? If if someone you live with has a cold and you're in each other's face and you're sharing drinks and you're in close contact, that's often sort of how those viruses spread as well.
So now that we understand where COVID-19 is, why is it so important for us to wear a mask in public?
So, right. So, the evidence has shown us sort of again and again that wearing a mask really does limit the spread. If you just think about it mechanically, like I just said, spreading droplets as you breathe or as you cough or as you sneeze. When you sneeze, the droplets from your sneeze can travel about a good 6 feet, right? So having a mask, having literally a physical barrier from your, that covers your face and sort of prevents things from moving out, has been shown time and time again to really limit the spread of these respiratory viruses. But even before the pandemic, during flu season, we would tell patients, if you're sick or not feeling well, to put a mask on when you come into clinic, or put a mask on when you come into the hospital. When people, would be admitted with the flu, we would put masks on when we went into the rooms and ask them to wear a mask as well. This is all pre-pandemic. So we've known that, wearing a mask really does sort of limit the spread of these respiratory viruses. So this is why it's so important. It's not, some people maybe see mask wearing as, oh, what is it really doing? And, why do I have to do this? I prefer, I can't breathe well under it. You can't hear what I'm saying under it. Right. It's sort of, a lot of people I know, sort of, view mask wearing as an inconvenience. But again, I think we have to look at the bigger picture here is that we're living in a time where there's a really, dangerous virus being spread. And wearing your mask really is a way to sort of keep others around you safe, because you're sort of preventing what you're breathing out into getting to them. And so I think it's, it's more for the community that we do this, more so than, any other reasons people might have.
So just being considerate of others along with yourself to keep yourself safe by wearing a mask, it really helps a lot.
Absolutely. Yep.
Good. What are the latest vaccines that's available now, and what's the difference between them?
Yeah. So there's 3 vaccines on the market here in the United States. The first one that came out was the Pfizer vaccine. The other one that came out was a vaccine by Moderna. And the third that sort of came out shortly after was the Johnson & Johnson vaccine. So the Pfizer vaccine and the Moderna vaccine work using what's called mRNA. Okay. And so to take a step back for a second for the listeners, when you get a vaccine, the whole point of a vaccine is to sort of give your immune system kind of a profile, or give them a bit of an idea of what the virus is going to look like. Okay. And so when you get a vaccine, your immune system sort of sees the vaccine. It sees, it's almost like a warrant for the arrest of this virus, right? So it sees the picture, the name, the description. Yeah. And now if that virus shows up, your immune system's ready to go. It's already been exposed. It knows it's, if I see this, we're going to kill, right? Like we're going to go in there and go in for the kill. And so these mRNA vaccines like Pfizer and Moderna, essentially what they do is you get the shot. Your body sort of gets accustomed and gets used to kind of what this virus is going to look like. And then if you are ultimately exposed and you do end up, contracting COVID, essentially your immune system is primed and ready to go. It's ready to strike against a virus if you do ultimately get it. For the Pfizer vaccine, it's 2 doses. It has been given 3 weeks apart. Okay. The Moderna vaccine is also 2 doses, typically given about 4 weeks apart. The first dose, is sort of meant as a primer, and the second dose is really sort of meant for, to give your body a second chance to really get exposed to what the virus looks like and be ready, should you potentially get infection thereafter. We typically consider people immune 2 weeks after they've gotten the second dose. The Johnson & Johnson vaccine works a little differently. That is 1 shot, and that one does not use an mRNA technology. That one uses what they call a viral vector. So it sort of uses a different process to essentially get your immune system to see the virus, and to be ready for it, should you ultimately contract it. So it sort of is another opportunity, another means of getting your immune system ready to strike should you get exposed to the virus. One thing I'll say about both these technologies, I know that some of your listeners maybe are concerned about, what's this new fancy technology they've got for these viruses. mRNA, using mRNA as, a vector, or using mRNA as a way for, vaccine production and things like this. Technology wise, this has been around for years. It's not anything terribly novel or new. They've sort of just found, kind of a new way to reuse sort of an old way of doing it to sort of make it work for this vaccine. So with both of these, the J&J vaccine and the Moderna and Pfizer, there's not anything that new about the actual way the vaccines work. Okay. We've just, thankfully, we found a way to make this work to protect people against COVID.
So I just want to dig in just a little bit more about the vaccine. So there's no microchips in it.
No microchips.
The government's not using it to spy on us, to track us, anything like that.
Nope.
It's just good medicine here to fight the virus.
Right. If people listening are that concerned about being tracked, they should think about what they carry in their pocket every day
Yes.
in the version of a cell phone.
Yes.
You want to know about something that can track you and your location, and you worry about, if people are worried about that,
Right.
I hate to break it to you, but your cell phone is a easy way to track you. So this vaccine, in all seriousness, though, this vaccine, there's no microchip. There's no, conspiracy to,
Yes.
kill people off or test on people.
Right.
We are, at the time this vaccine came around, we are still in a lot of ways really desperate. We're just desperate to find something to help combat this virus, to defeat this enemy. So, but thank God for science. They were able to sort of, find this vaccine sort of in rapid time, manufacture it and deliver it. And I think we're seeing a lot of positive effects of this.
Yes. 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 Because they are vaccines and they are man-made, what are some of the side effects of the vaccine?
Yeah. So the most common side effects that people have once they get the vaccine, the one that I think probably most people will say if they've gotten it, is some arm soreness. So sort of in the area where you got the vaccine, there tends to be a bit of a local inflammation in your arm. So you might have a bit of a sore arm for probably a few days after you gotten the vaccine. The other effects that people get, the systemic effects that people may feel, some people get, feel feverish. Fatigue is a pretty common symptom. People sort of just feel tired, like they just kind of want to, lay down in bed. Some people get headaches. A small, percentage of people may get some GI side effects that might feel a little nauseous or just sort of not feel so great.
Okay.
These effects don't happen in everyone, and these effects are often very time limited. So, you get the vaccine on a Monday, you may not feel well, maybe Monday night or into Tuesday morning. And then often by sort of, Tuesday night or Wednesday, odds are probably feeling a lot better. And what I advise patients to do, over-the-counter stuff, Tylenol, ibuprofen, Motrin, Aleve, any of those kinds of medications you use. If you're not feeling well, or you feel kind of achy, or you're having a fever or headache, all those medications are safe to use, and they often people tend to feel a lot better after they sort of take one of those. Get some rest, stay hydrated, do all the things you'd normally do.
Right.
If you're not feeling great, and then people, it's very self-limited. People literally tend to recover within 24 or 48 hours. People feel completely back to normal.
Is it safe to say it's as if you're getting a flu shot, some of the same side effects as you was getting your flu shot?
Yeah, there are some people, get a flu shot. They maybe don't feel so great for the first 24 hours or so. Similar pattern here. You get the vaccine, you may not feel great. What I try to remind people is, this is just for a day. And I feel like I'd much rather have, not feel great for a day than to have COVID and not feel great for weeks or months, or maybe not ever feel good again. Right. So I think it's a trade-off I was willing to take. I know everyone has to make their own call on this. But people do have side effects. I think we can't lie and say, oh, it's all great. No one ever feels bad after they've gotten the vaccine. Right. There's some people who don't feel great, but again, it's very time limited, and people tend to feel better pretty quickly.
Thank you. Why is it so important for anyone to get the vaccine?
That's a good question. I think the two biggest reasons, one is to protect yourself. These vaccines have been shown to have efficacy in terms of preventing people from getting hospitalized and dying. And I think it's important to distinguish that. There are some people who think I heard someone got the vaccine, they still got sick, right? So again, when they did these trials, what they were looking for was from the people who got the vaccine, who ended up in the hospital and who ended up dying. And the numbers of people who ended up in the hospital and ended up dying were very, very low. So the efficacy of these vaccines is very high. People who got the vaccine, very small numbers of people will be in the hospital, and super small numbers of people will die from it. So, protecting yourself, I think, is important. I think the other piece is really protecting those around you. As I mentioned before, viruses mutate, right? So viruses, get into your cells, they replicate, they make more copies of themselves. And as a result of that process, they can also make mutations. So some of these strains and some of these different variants we got are because COVID has had a chance to get into a lot of different people, make some new mutations, and then become more contagious and sort of, find a way to try to find a way to outsmart us in a way. So, when you think about, what vaccines do for you personally, that's great, but think about what it does for the community, and sort of limiting the spread of this virus, and sort of, limiting, this virus and getting to you and getting to other people around you, and potentially creating new mutations that we now have to fight against. So, the vaccine's important for you. It's important for the people around you. All that, to add to that, I'll say, as we said before, wearing a mask, even when you're vaccinated, also important. So sort of those things all together are really how we're going to get past this and sort of, go back to some sense of normal. The vaccines really give us the best opportunity to do that. So I would encourage everyone listening, if you are thinking about it or you have questions, seek out people, professionals like physicians or people you really trust, at least, to get their advice on this. But, I think the only way we'll get back to any sense of normal is we have to get past get past this virus. And this vaccine really gives us the best chance to do that.
Here's another question for those who have kids. Is the vaccine safe for children?
So the vaccine was approved for ages 12 and up. So for anyone who has any, children sort of in the 12 up to 18 range, it is okay for them. They were sort of included in some trials, some subgroups, and, have been proven to be safe for them. For people with younger children, which I include myself, we have a 6-year-old and a 5-year-old. Pfizer recently applied for emergency use authorization for the vaccine to be used in children. So hopefully in the next few weeks, hopefully by Halloween or maybe a little bit thereafter, this vaccine will be available for younger children. The data on this, again, just like the data for adults, showed high efficacy that this virus is safe to be used in children. For what it's worth, for those who are listening, the dosage of the virus is actually, I think, about a third lower, about a third of the dose that you give to adults, because children typically, typically don't need as much of the virus, didn't need as much of the vaccine to really mount an immune response. So, so children who will be getting the vaccine when it's available, hopefully in the coming weeks for smaller children, will be getting sort of a small dose of the vaccine. They will, mount an immune response. And, this, I feel like for a lot of us, this is what we've been waiting for. My wife and I are both vaccinated. We've been waiting for our children to get vaccinated. I feel like, we sort of have been trying to shelter and keep them safe. And, you worry about your children getting sick.
Yeah, I feel you.
And so, right. So, the vaccines have been proven safe in children. When those are available, I'd encourage everyone as well to please, get your children vaccinated and protect them as well.
Yeah, especially by the kids being in school and everything, it will help, from community spread from happening there. I agree with
Definitely.
You. Well, as you was leading before, so people can understand, what are the new strains of COVID?
Yeah. So the one that has made the most news is the Delta variant. When COVID, the first sort of COVID strains that came around, we believe started sort of in Wuhan in China, the Wuhan region in China, and then sort of spread kind of globally though after. Initially, there was a lot of, when we sort of named the viruses, we were sort of naming them based on the kind of regions that, a certain variant kind of sprang up. So for a while, there was like the South African variant. Then there was the Indian variant. They sort of gave them names based on location. To be a little bit more sort of sensitive to kind of what that, kind of naming it for a region, what that sort of might lead to. Right. They sort of decided, probably, I guess maybe around a year ago or so, to then sort of just give them names, essentially going, down the Greek alphabet, is what they're basically doing now. So the variant that originally came from India has sort of been kind of renamed into, the Delta variant. And so this strain is one of a number of strains that are out there. It's the predominant strain here in the United States right now. We do some testing at our hospital periodically to sort of look at, the patients we have are admitted for coronavirus, kind of what strain of the virus do they have? And, each time it's the Delta variant. It's sort of the one that is most, prevalent here. This variant is much more contagious. Again, this is sort of the virus's way of trying to, kind of level up here and try to, outwit the vaccines and sort of outwit what we're doing to prevent. So it is now more contagious. it's not entirely clear if it is more deadly, but there was some concern earlier on. And there was still sort of continued concern that this variant actually might even kill more people than some of the earlier variants. But, this is sort of what I think, if we don't sort of put an end to this is unfortunately what I feel like our future will sort of entail is today it's a Delta variant, tomorrow it could be the Epsilon, or it could be the Lambda, or, we can sort of work our way down the Greek alphabet, which is unfortunate. But, I think we are really at a point now where we can, hopefully get this under control and really stamp this out for good. Viruses, and to be, completely honest, viruses like this don't necessarily all go away entirely, not like they're vanquished from the earth.
Right.
But they get so controlled, or so their numbers and the number of people infected get so small that they sort of become, as one of my colleagues in infectious disease calls it, they sort of just become these annoying viruses that we sort of just test for, but really don't happen very often in our population, right? So that's where we kind of want to put COVID, right?
Right.
We want it to kind of be, a virus that, it's around a little bit here and there, but it's not one that's infecting, killing, thousands and millions of people. And so that's, I think, where we really want to relegate this virus. But it's going to take some time. I think we're in a better place right now as we're talking. I hope that we're in a better place in the months to come. We've sort of seen these waves of the virus are sort of on the backside of another wave that we sort of got here at the end of the summer, kind of into the early fall. But yeah, Delta, variant is sort of the prevalent strain here in the States. And I think we have to do our part to make sure we don't develop more of them.
Yeah. I've been hearing this a lot, and I think a lot of people are hearing this a lot in the news also. What exactly what they call, what is a breakthrough case of COVID? What is that?
Right. So a breakthrough case of COVID is essentially a COVID infection that happens in a vaccinated person. And so, if someone's been vaccinated, then contracts COVID, tests positive for it, that's considered a breakthrough case. Initially, we believed, and still do sort of believe, that, once you get the vaccine is to sort of help your body fight coronavirus if you are exposed. It attacks sort of these spike proteins that are sort of on the, around the capsule of the virus to kind of prevent it from really infecting you, really spreading. So, our thought is sort of, you get exposed, you sort of deal with it, and you're hopefully not infectious, not going to contract it, then spread it to other people. What we sort of have found over time is that people do get infections even after they've had the vaccine. But again, those that get the infections typically do not end up in the hospital and do not die. And so that is sort of some of the prevention. But they, could potentially spread it if they are sick, and are actually symptom-wise sick, can continue to spread it. So this is, again, why, wearing masks is important, even when you are vaccinated, to sort of control potential spread. There was advice probably, I guess, about a month ago for people to get boosters. So for those of your listeners who got vaccinated maybe more than 6 months out with the Pfizer vaccine, which is the one that's been approved for a booster, if you're over the age of 65 or have certain medical conditions or immunocompromised, the recommendation is, if you've had the vaccine greater than the second dose more than 6 months ago, is to go ahead and get a booster. I got a booster last week because they also added in healthcare workers and people with sort of high risk of exposure. So a number of my colleagues, me included, we all went and got our vaccine, our booster vaccine, just to make sure, if there is any waning of our immunity, if our, the antibodies that we built up when we got our vaccines, at the end of last year, if any of that is not as strong or robust as it could be, that we really sort of give our immune system another shot to kind of build up those antibody levels again as we go into the winter. So that's sort of the story on breakthrough infections.
Thank you. Well, Doc, it's two questions I've been asking all my guests, and the first question is where did you garner or find your love for helping people? Where did it originate? Where did it start for you?
Wow, that's a good question. I feel like I've always had always wanted to kind of help people out. I don't know exactly where necessarily it all came from. I used to volunteer as a kid. As a high school student, I would do a lot of volunteering. I feel like a lot of it probably came from my parents, both of whom were raised in the South. Were not raised with much. Moved out to California for new opportunities, and then that's sort of where me and my sister grew up. So I think a lot of that really came, I think, from good role modeling from my parents, that they were always there to help others out.
Yeah.
I know you are a chef. My mom was from Louisiana and loved to cook.
Yeah.
And so she would always say, in her family, they didn't have a lot of money, but they always had food. And so people in the neighborhood, so-and-so lost their job, their family. And so her mom would cook and bring her, a pot of gumbo, or bring her some some shrimp that they just, threw together, some crawfish, and would bring over food. So I think for me, having that as a role model, I think growing up, that, you help out people around you. You don't, these are people in your community. These are not strangers.
Right.
That you're always kind of there for others. I think that's where it got ingrained in me, to just do that for people around you, to not sort of turn a blind eye or pretend that people are not experiencing problems or challenges in their lives.
Yeah.
I love science as a kid. I love science in middle school and high school. So, that sort of love of science and thinking about ways to kind of use that to help others is sort of what kind of pulled me towards medicine. So, but yeah, I definitely have to thank my parents, I think, for a lot of the, kind of what made me want to, have that desire to help others.
I commend you, Doc. I commend you. A lot of people don't know that food brings people together. Unless they guard down from the open up, that it can bring healing, it can bring peace, and it also embeds good memories around conversations or being around your loved ones. So that's the reason why I fell in love with cooking.
Yeah, definitely.
The second question I've been asking a lot of my guests is, how has this pandemic been for you and your staff? In this past year and a half, dealing with it. How has it been?
It's been hard. I'm not, I'm not even gonna lie. It has been a challenge. It's been emotionally, spiritually, physically. It has been really hard. I feel like I was kind of using this as a comparison to people the other day. You think about those movies, those movies where, there's some threat to humanity, or some, aliens come from outer space, or like this, a movie that I feel was really relevant. I don't know if people saw this about 10 years ago, this movie called Contagion, that essentially, if you watch it now, your jaw will drop, because you'll literally think this movie predicted kind of what was coming.
Yeah.
But you think of these movies where there's some big threat to the human race, and somehow at the end of the movie, the heroes find a way to deal with the enemy, to defeat them, and everything. There's sort of the victory at the end where everybody is cheering, and it's like we're all over, and then the credits roll, and then we're good, right?
Yeah.
So I'll be honest, when the vaccines came out, that was where I was like, this is our moment. We got this vaccine, like roll the credits. We can go cheer on the mountaintop. Like, we got this. We defeated the enemy.
Yeah.
And then now it feels like we're in a bad sequel. It just feels like, I thought we were there, and then you just saw that, we were on a good roll. And then unfortunately things just, people getting vaccinated, people were like, everything just sort of fell apart around, I'd say about midsummer, things sort of fell apart again. So that is hard, I think, for a lot of us in the medical profession, because I was there, we've been there on the front lines. We've, been there in the hospital. I've seen patients die alone. I've helped wheel in the iPads so they can talk to their loved ones. I've sort of seen a lot of this firsthand, and it's been a long road. And I think a lot of us, I was mentally prepared for a year of this. I wasn't really prepared for 2 years of this, or even 3 years of this. I think, for parents out there, I wasn't prepared for my kids to have to go through, another year of this. They're, 5 and 6, and they're still pretty young and might not remember a lot of this. But I know there are a lot of people out there who have kids who are older who will all remember this. There are kids who missed graduations and proms and missed other important events in their lives. There are people who miss important things in their lives. So all to say that this has been hard for a lot of us in the medical profession. I know it's been hard for people in your field as well, with restaurants and and things like that. It's just, this has been hard for a lot of people. But I am an eternal optimist, and I'm hopeful that we will get past this. and that hopefully in the coming years, some, whatever our new normal is, which hopefully is not this. Hopefully our new normal will be more like our old normal, but I'm hopeful at some point we'll get past this and move on.
Well, questions, that I've been having conversations with my wife, about she's being a nurse and stuff like that. She was like, it's like really tough, especially on you guys, because y'all the front line, y'all actually dealing with the patients that really get sick. And a lot of people are not taking this seriously. And that's my hope with this, with this interview, that people actually take this virus and this pandemic seriously and do what you have to do to take care of yourself, to stay healthy, because it's important. Like, cause I had a loved one that passed from COVID and they wasn't vaccinated. So it's just like really serious that, people take this seriously. Do due diligence. If you have questions, reach out there. You can reach out to Dr. Childs. He left his, what's your Twitter handle again?
Dr. Childs, MD. Dr. Childs, MD.
Like, if you have questions, just ask, because I'd rather you have your questions answered than you just going by assumption or what you've seen on social media that may not actually be true. Well, this is the last question I have for you, Dr. Childs. What is the one thing that you would like to leave with us regarding COVID-19 and vaccine that most people may not be aware of?
Yeah. There's probably a lot that people are aware of. I think, we've been in this COVID struggle for so long that I don't know if I'm going to have any new breaking information, or whether they sort of didn't already maybe know about COVID or vaccines, or sort of how to prevent it. But, again, to sort of go back to what we said before, again, something else I'll tell people is like, I'm over this, this whole COVID thing, but it's not over. Right. So, a lot of us are over it. we want to move on. We want to have holidays this, Thanksgiving and Christmas. We want to have people in our house. We want to feel like old times. We want to do all that. But again, it's not over yet. And unfortunately, we probably have a little bit more ways to go. So, resilience, wellness, I think whatever people, do to make sure that you stay physically healthy, stay spiritually healthy, stay in this, because again, we still have a ways to go. So I think everyone's resilience and endurance, it's all going to be tested, but everyone just has to kind of stay in this fight, and we can't let our guard up. Right. We've come this far. This is not the time to sort of throw everything to the wayside and say, "Oh, I'm done. This is good. It's the holidays. Let's go ahead and do. Let's have everybody over and no mask and no vaccines. Let's just let everybody in the house and fingers crossed." We really have to, and then you find out 2 weeks later, oh, grandma got sick or somebody got sick. Yeah. So again, just people, don't let your guard up, vaccinated or not. I still wear a mask when I go into buildings. Yeah. I've now had 3 shots. So just you have to stay in this fight. This is, we're probably in the middle rounds, maybe the last, hopefully bitter rounds, but you just got to stay in this and just, don't let your guard up. Keep the fight up.
Yes. Doc, I want to thank you for coming on today's show, sharing your wisdom, your knowledge with our listeners. Hopefully someone, got what they needed to make it, an educated decision for themselves.